There is this test which can give you a lot of information about your body or that of the patient, or if you're the patient, it can give you a lot of information about what's going on in you. This test is so underrated, and we're going to go into the details of the information that you can get or you can derive from that, so that when you're asking your doctor the questions, you can ask relevant questions, and also you get to add more information to finalize the diagnosis. This test is called CBC. FHG, it has a lot of names. This is full hemogram. People call it FHG. Other call it CBC. This is complete blood count. We have others calling it full blood count. So they all refer to the same thing. Now, others even call it hemogram. In this video, we're going to call it FHG. Or if I at one point use any other name, you just know that I'm referring to full hemogram. Now, this usually focus on three things. Your blood usually contains two parts. The first part is the liquid part, the liquid, and we have now the solid, which is made up of the cells. So your blood is made up of the suspension of the cells and other things which are contained in this liquid. Now, this test usually focus on the cells. And in this test, we have several of them. The first one is white blood cells that are very, very important. We have the red blood cells. And then we have the platelets. They are all very important. So in this video, we're going to go into the details, what you're going to see in that report. Once they take your blood, they take to the laboratory, and it's written full hemogram, what you're going to expect and how to interpret that. Now, we're going to start off with the white blood cells. Remember, we said I usually focus on these three things. We're going to exhaust most of the information you as a patient need to know about this, so that you can also be at par with what the doctor is gearing toward. Now, let's start with white blood cells. Now, this, as you know, they are the soldiers of the body, meaning any foreign object will first of all meet these people here. It's a good population. It's made up of several cells, several types of cells, and they are all over your body. So they fight any foreign object in your body to make sure that you don't get an infection. We have 5 major categories, and in this you have neutrophils, we have lymphocytes, we have eosinophils, we have monocytes, and we have what we call basophils. They are very important. They play specific roles in your body, and either an increase or a decrease in any of these particularly will indicate a certain condition, as you are going to see. Like, for example, let's take the whole of this. In your full hemogram, you're going to find WBC count and a flag of whether it's high or low, because there's a normal range. Now, in that range, they usually differ. I'll avoid giving the range because they usually differ with the population. We have my population, you have maybe your population. They usually differ. You actually don't have to look for them. What usually happens is in your report, you're going to find, let's say, for example, you have your figure there, and then at the end here, you have normal ranges. They will be here. So there will be an indication from this to this will be normal. So in case it's higher than the range here, it's going to give a flag that either it's high or low. Now, in case you have white blood cells, if it's higher than the figure here, it means you have an infection. Now, it's not particularly pointing to a specific one, but you can tell that you have an infection because when you have an infection, your body will produce more of the white blood cells, and it's going to deploy them to areas where that infection is taking place so that it helps in fighting that infection. So in case it's high, or the flag is indicating that you have more white blood cells, it means that you have that infection. Now, this is going to confuse you a little bit because also when you have low white blood cells, you might also be having an infection. And this is the reason. We have some infections that will lead to decrease in the population of the white blood cells. Take, for example, something like tuberculosis. TB, what happens is when you are infected with this, you breathe in that tuberculi, it will go to your lungs, in the alveoli, and it's going to find cells that we call macrophages. The macrophages will start fighting off this bacilli, and when that happens, because you see TB is quite stubborn, so it doesn't die, it's unable to do that. it tries to do what you call antigen presentation. So it takes this antigen to the lymphocytes, like you are going to see later on, so that the lymphocytes can mobilize a troop of factors that will help in fighting off this infection. But you find that you have attachment with other macrophages that are trying to fight off this bacilli. So you have this bacilli, we have macrophages trying to engulf and kill this bacilli here. They end up forming what we call granuloma. Now, this granuloma is a composition of several of those cells, meaning that just a group of cells, of white blood cells, are trying to fight maybe just a single bacilli. And this will lead to most of them will die, meaning that there will be a decrease in this population. Another thing is something like immunosuppression. You have something like HIV. This virus, when you get this, it leads to decline in those cells that have CD4 receptors. The CD4 cell receptor, we have macrophages, we have dendritic cells. All this, they have these receptors. What happens is HIV will get into that cell and then replicate by using the mechanisms of the cell. And after replication, when there are so many copies, it kills this cell so that it will get an opportunity to now get out, get into the blood, and then go start looking for other CD4 cells to infect, and then the cycle continues. And when that happens, they are going to kill off so many of the white blood cells, and that's going to go lower. So in case you have an increase, you might be having either an infection or maybe a proliferation of your cell more than normal, where you find something like leukemia. When it's low, you might also be having like an infection by a different kind of a pathogen. So in case you have this, then it's indicative of an infection. So it should always remain within the range. Your body has a mechanism of making sure that they are all within the range. Now, this is generally about the white blood cells. Let's go to now the particulars. When you have neutrophils are very good at fighting off bacteria, fungi. So they try to fight off this. So if you have an increase in neutrophils, it means you're fighting a bacterial infection or a fungal infection. Lymphocytes, this is the adaptive immunity. And mostly, when you have something stubborn and there was something like antigen presentation, like we said, like something like a macrophage will come, pick that antigen, go present it to the lymphocytes. These are the, what do we call them? They are the snipers. They are silent killers. They are very intelligent. This is the adaptive immunity. So they'll go identify something, and they are able to create a specialized army that will come and fight off whatever that is in question. So the lymphocytes, and this is where now the viruses comes in, viruses. So it fights off the virus. So if in case you have an increase in lymphocytes, you might be having viruses that are in your body. Let's go to eosinophils. Now, these are very good at killing or fighting off large parasites. So they help in fighting off the parasites. In case you have an increase in eosinophils, you have a parasite somewhere. Now, look at monocytes. These ones, remember we are talking about macrophages, whose work is antigen presentation. They form the monocytes, and they help in fighting off those stubborn illnesses. In case you have an increase in monocytes, you have something stubborn that you're trying to fight off. Now, let's go to basophils. This is where you have allergic reactions. When you have an increase in basophils, there is an allergic reaction that's going on in your body. Now, that's about white blood cells. Let's go to a very interesting one, red blood cells. Now, red blood cells, they make your blood look red. So the red blood cells usually have something that we call HB. This is hemoglobin, and it's very essential. HB help in transporting or dissolving oxygen from your lungs and take that to the tissues, and then it takes back carbon dioxide to the lungs, and then this is removed from your lungs, then it goes out. So it's very helpful when it comes to aeration in your body. Now, let's go to now the particulars. When it comes to red blood cells, we have the indices, but we're not going to look into them. They are more technical, and we are going to dedicate a video on abnormalities that are surrounding red blood cells, and also those that usually surround white blood cells, like leukemia. So we are going to focus on the red blood cells right now, and what you can deduce from your lab report, that the CBC report or the full hemogram. Now, the red blood cells, there are several things that are checked. One is very important, which is the HB. This is the hemoglobin level. Now, in my population, the normal range ranges from 13 to 17. This is in men, and this is in grams per deciliter. For females, it's 12.5 to 16.5 grams per deciliter. Now, for the females, this is slightly different because they usually get their monthly menses, so that lowers much of their HB. This is their normal ranges. Now, this is my population based on where I am currently staying at. If you move to something like a highlands, in highlands, you have low concentration of oxygen, and this will necessitate your body to compensate for that by increasing the amount of HB that you have. So those people who usually live in highlands are likely to have higher HB levels, which is still normal for them, and that's why I'm saying that this is subjective according to the population, and this is because of the nature, the place that they are staying, the amount of oxygen in the air. Now you go to somewhere like let's say sea level, there oxygen is high, so your body does not require to have a lot of HB to compensate for that, because the oxygen is readily available. So even a low level of HB can still function there. So they don't need to actually have a lot of HB to give them enough oxygen. So their normal ranges can differ. But regardless, so long as we have the normal values, let's take for example my population between 13 to 17 and between 12.5 to 16.5 grams per deciliter. This is for men, and this is for the females. Now, in case it's lower than this, you have anemia. And you should investigate now what type of anemia that you have. This is where now your doctor will start now querying for other things in your body. Like they can send you to a test that we call PBF and others that will help in trying to exactly tell us how these red blood cells are looking like, so that they can be able to know the exact picture. Now, let's get away from this. This is still another topic for another day. It's a very detailed, it's a very interesting. By the way, you should make sure that you are subscribed. And if you have anything above this, it's still an abnormal situation, whereby you find that those people with polycythemia will have an increased number of red blood cells, and this is also a problem in their system. They need to get rid of the excess red blood cells, and one of the ways that they usually help them is we encourage them to go and donate their blood, and their blood is just discarded. So that will reduce the stress in your body. So you're going to reduce the amount of the red blood cells that you have in your system, and those people usually have a higher HB. So you can also use this HB to know exactly what's going on. Now, that's about that. So in case maybe it's high, you start querying about the polycythemia. In case your HB is low, you start querying something like the anemias. Now, let's go to other interesting things. There are several things we can learn about red blood cells still from the same report. You have MCV, which is mean corpuscular volume. Now, this is the volume of the red blood cells. You might have issues or some situation where the red blood cell, the volume is low, meaning that even the quality of the HB that you have in that cell is not as good. And this will start now indicating several types of issues with your red blood cells, and they are pointing toward either you having less of iron, or some vitamins that help in production of the red blood cells. And we have something like the HCT, very important, something I know it's interesting too. And this is someone will come prick you. So you can have this HCT as a separate test, but this is still included in the full hemogram report that your blood was taken for. So we just come, take blood, put in a tube, and then they go measure all this. So one of that will be HCT. This is hematocrit. It's given in percentage. Now, what is this? What happens here is in a standalone HCT, your blood is taken, put in a very tiny tube. So they spin that in very high speeds. And then what will happen is will be now the separation of this. Remember, we said blood contains the liquid part and also the cells. Now it's going to separate these two so that you get the cells here and the liquid part here. Now this will give an indication of the ratio between now the liquid part of your blood and the cells. In case you have an increase in the number of cells, let's say, for example, it went all that. So the only thing that you have here is the liquid part of your blood is just only occupying this. And it means that the HCT value will be very high. And we said it's in percentage. It will be high. Now, when this is high, it means that either you are dehydrated, you don't have as much water in your system as required, or you have conditions like polycythemia, like we said. You have overproduction of the, you can also even be having something like leukemia. So you have overproduction of the cells, and they are all piling up in your system, meaning that the ratio is going to go high. Now, you might have a reverse of the same. So you have so much water in your system, meaning maybe that was overhydration, and a few of the cells. And also you might also be having other issues with your system, such that not so much of the cells are being produced, plus other things. Now, when you're still talking about HCT, there's another test that we call ESR. Now, this is almost similar to this, but now when it comes to this one, you don't use the centrifuge. You're using gravity. You put blood, but this is not included in the full hemogram report. There's a blood, it's put in a tube like this one, then blood is put to maybe this point here, and then it's given 1 hour. Now, in this 1 hour, blood will start, the cells will start settling by using gravity. Now, they're going to settle, and the upper part, you're going to find the liquid part, and the cells will settle here. Now, after 1 hour, the reading of where the cells have sedimented to will be measured, and this is now indicative of other issues. Like, for example, you have inflammation, you have so many other conditions that can lead to either you having a high number or a low number when it comes to ESR. Now, in the future, I'm going to make a video on the red blood cells, the anomalies, the anemias that we have, the cancers that you usually get in blood that usually affect this, and other issues like the MCVs that we have said, and the MCHC. So let's go to now the final one, which is very important and is still in the report here, the full hemogram. It's called the platelets. The platelets are very, very important, and you all know this because when you get injured, maybe one of your vessel has been injured, maybe it's a vein, maybe it's a capillary or an artery. In case any of this is injured, blood will start coming out, and when that happens, then it's the work of the platelets and another system that we call the coagulation cascade to make sure that maybe this was the vein and you had an injury there. It's the work of the platelets to initiate formation of a plug that will seal off this area so that you stop losing blood. So if you didn't have this system or you didn't have the platelets, you might end up bleeding so much and you lose a lot of your blood, and you might end up even dying. Now, the platelets are indicative of something very important in the body. So you have the platelets. In case there is an increase, it's beyond the normal. So remember, we said in the report you're also going to get the normal ranges so that you can be able to interpret the figure that was gotten from your blood. So in case it's high, this is a risk factor. If you have so many of the platelets in your system, it means there's a potential for you forming clots when you're not even injured. And the clots, we call them the thrombus. So when you get those clots which are not necessary, they might end up forming very devastating effects in your system, because you might have that clot in your brain. When you get that, you get something that we call stroke, where you find that maybe one part of your system symmetrically is not working, because maybe that clot went and lodged into some of those arteries that usually take blood to your brains. Now, so you might give stroke, myocardial infarction, those heart attacks, because the heart is also supplied by arteries, and when that happens, in case this let's say this thrombus, the clot, if it lodges in one of the arteries, it means that your heart will not be getting enough oxygen or enough of the nutrients, and that might trigger heart attacks. If you have less of this, it means that your body is not in a capacity to quickly form the clot when needed. When you have an injury, they are not able to seal off that area where you have that injury, so you might end up losing a lot of blood, and when that happens, so much other bad things might happen to your body. So when this is low, you have those disorders or bleeding disorders. When you have more of this, it's also a disorder. Now it needs to stay between the high and the low, so this is the normal range. So by now you can see the power of that simple test, CBC, complete blood count. Now there's one thing that I want to make sure I put across. This is not a definitive test. You cannot use full hemogram to know exactly, hey, this person is suffering from tuberculosis, this person is suffering from influenza, or this person is having a parasitic attack. I can only know that you have an infection, but I'm not, it's not specific to what kind of an infection it is. But it's a very, very good place to start off from. If you get the figures, like for example, your white blood cells are high, and then you find that in the differentiation, you find that you have neutrophils, which are more, so you now start querying. Now, this person might be having a bacterial infection, or this person is having a fungal infection. And now you can now take further tests that will now target whether this person is having maybe the bacteria or the fungi. And then you can give them the antibiotics or the antifungals. Now, this is a good screening test. I hope you're gaining value, and if you're gaining, give us a sub, give us a like, share this video to those who are interested. I'm sure you have a lot of friends that will require this information. And also, let's continue the conversation down there in the comment region.